Hello, this video will help you learn how to use your BREZTRI AEROSPHERE inhaler. Before we get started, please read over the instructions that came with your inhaler. Do note that this inhaler may be different from inhalers you have used before. There are 3 sections, including preparing your inhaler for first use, taking your daily dose, and rinsing your inhaler. Now, let's begin with how to prepare your inhaler for use. There are 5 main components: the mouthpiece cover, the mouthpiece, the actuator, the canister, and the puff indicator. How to read the puff indicator. The puff indicator will count down by 1 each time you spray a puff of medicine. The puff indicator display window has a number for every 10 puffs. The arrow points to the number of puffs remaining. Order a new inhaler when the pointer is in the yellow zone, as it's time to refill your medication. Remember, do not take a puff when the pointer is in the red zone, because you will not receive a full dose. Before using your inhaler for the first time, you need to prime it so that you will get the right amount of medicine when you use it. Do not skip priming. Extra puffs are provided for priming. Begin by removing the mouthpiece cover. Shake the inhaler well and press to spray 1 test puff into the air facing away from you. Repeat these steps 3 more times for a total of 4 test puffs, shaking before each test puff. Now, your inhaler is ready for use. Let's look at how to use your inhaler daily. Begin by removing the mouthpiece cover. Check the mouthpiece for foreign objects and remove any objects before use. Shake the inhaler well before each puff. Breathe out fully. Place the mouthpiece into the mouth and close lips around the mouthpiece. Start to breathe in deeply and slowly while spraying 1 puff. Continue breathing in until you cannot anymore. Hold your breath for as long as you can, up to 10 seconds. Now take your second puff by repeating these steps. After taking your second puff, put the mouthpiece cover back on. Rinse your mouth with water. Spit out the water. Do not swallow. Remember, take 2 puffs of medicine in the morning and 2 puffs of medicine in the evening. Let's discuss how to rinse your inhaler. Rinse your actuator weekly so that medicine does not build up and block the spray through the mouthpiece. Begin by removing the canister and set aside. Ensure you do not allow the canister to get wet. Remove the mouthpiece cover and run warm water through the mouthpiece for 30 seconds and then through the top of the actuator for 30 seconds. Rinse for 60 seconds in total. Shake off as much water as you can. Do not dry the actuator with a towel or tissue. Look into the actuator and mouthpiece for medicine buildup. If there is any buildup, rinse again. Let the actuator air dry, such as overnight. Do not put the canister back into the actuator if it's still wet. When the actuator is dry, assemble your inhaler by replacing the mouthpiece cover first and then gently press the canister down into the actuator. After rinsing and drying, reprime the inhaler by spraying 2 test puffs, shaking well before each test puff. You should also reprime after rinsing the actuator, if dropped, or if not used for more than 7 days. Thank you for taking the time to learn about your BREZTRI AEROSPHERE inhaler. If you have any questions, be sure to ask your healthcare professional. Please continue watching until the end of the video for additional important safety information that you'll want to know about BREZTRI. BREZTRI AEROSPHERE is a medicine used long-term to treat chronic obstructive pulmonary disease, COPD, including chronic bronchitis, emphysema, or both, for better breathing and fewer flare-ups. BREZTRI is not used to relieve sudden breathing problems and will not replace a rescue inhaler. BREZTRI is not for the treatment of asthma. BREZTRI combines 3 medicines: an inhaled corticosteroid, ICS medicine, budesonide, an anticholinergic medicine, glycopyrrolate, and a long-acting beta-2 adrenergic agonist, LABA medicine, formoterol fumarate. LABA medicines such as formoterol fumarate, when used alone, can increase the risk of hospitalizations and death from asthma problems. When an ICS and LABA are used together, this risk is not significantly increased. Do not use BREZTRI if you are allergic to budesonide, glycopyrrolate, formoterol fumarate, or any of the ingredients in BREZTRI. Do not take BREZTRI with other medicines that contain a long-acting beta-2 adrenergic agonist, LABA, or an anticholinergic for any reason. Tell your healthcare provider about all your medical conditions and about all the medicines you take. BREZTRI should be taken as 2 puffs 2 times each day. Do not use BREZTRI more often than prescribed. Call your healthcare provider or get medical care right away if your breathing problems get worse, if you need to use your rescue inhaler more often than usual, or your rescue inhaler does not work as well to relieve your symptoms. BREZTRI can cause serious side effects, including fungal infection in your mouth or throat, thrush. Rinse your mouth with water without swallowing after using BREZTRI to help reduce your chance of getting thrush. Pneumonia. People with COPD have a higher chance of getting pneumonia. Call your healthcare provider if you notice an increase in mucus, sputum production, or change in mucus color, fever, chills, increased cough, or increased breathing problems. Weakened immune system and increased chance of getting infections, immunosuppression. Reduced adrenal function, adrenal insufficiency. This can happen when you stop taking oral corticosteroid medicines and start inhaled corticosteroid medicine. Sudden breathing problems immediately after inhaling BREZTRI. If this happens, stop taking BREZTRI and call your healthcare provider right away. Serious allergic reactions. Call your healthcare provider or get emergency medical care if you get any of the following symptoms: rash, hives, swelling of your face, mouth, and tongue, or breathing problems. Effects on your heart, such as increased blood pressure, a fast or irregular heartbeat, or chest pain. Effects on your nervous system, such as tremor or nervousness, bone thinning or weakness, osteoporosis, acute narrow-angle glaucoma and cataracts. If you have new or worsening eye or vision problems, call your healthcare provider right away before taking another dose. Urinary retention. If you have new or worsening symptoms or difficulty urinating, stop taking BREZTRI and call your healthcare provider right away before taking another dose. Changes in laboratory blood values, including high levels of blood sugar, hyperglycemia, and low levels of potassium, hypokalemia. Low levels of potassium may cause symptoms of muscle spasm, muscle weakness, or abnormal heart rhythm. Most common side effects include upper respiratory tract infection, pneumonia, hoarseness, back pain, thrush in your mouth and throat, flu, muscle spasms, urinary tract infection, cough, inflammation of the sinuses, and diarrhea. Please see full prescribing information and patient information and discuss with your doctor.